Your body's hidden foundation. Introducing the pelvic floor and perineum. The pelvic floor is a remarkable group of muscles. It is located at the base of your pelvis. Think of it like a muscular hammock or a supportive sling. This structure stretches from your pubic bone at the front of your body. It extends all the way to your tailbone, which is at the back. These muscles are often hidden from view and not frequently discussed. Yet, they are incredibly important for your overall health and daily comfort. Understanding them is the first step to appreciating their vital role. Next, let's talk about the perineum. The perineum is the external area located between your legs. In women, it is the region between the vaginal opening and the anus. In men, it is the area between the scrotum and the anus. It is a relatively small diamond-shaped surface. The perineum sits just below the pelvic floor muscles. It forms the external boundary of the pelvic outlet. While distinct from the deeper pelvic floor, it works closely with it. It is a sensitive area with several important functions we will explore. These internal and external structures work together silently. They support many of your body's essential functions every single day. Most of the time, you are not even aware of them working. That is, until something goes a little bit wrong. Because they are out of sight, it is easy to overlook their significance. However, their strength and proper function are fundamental. They contribute significantly to your quality of life, more than you might realize. We want to bring these important structures into the light for you. In this discussion, our goal is simple. We want to help you understand your pelvic floor and perineum better. We will look at their basic anatomy. We will explore what they do and why they are so important. We will also touch upon some common issues that can affect this region. Knowledge is power, especially when it comes to your health. By learning about this crucial part of your body, you can take better care of yourself. Let's begin this journey of discovery together. A closer look. Understanding the anatomy and structure. The pelvic floor is not just one single muscle. It is actually a complex arrangement of several layers of muscles and tissues. The main group of muscles is called the levator ani. This name literally means lifter of the anus. These muscles form a broad, thin sheath that acts like a supportive bowl or funnel. Other smaller muscles also contribute to this intricate network. Together, they create a dynamic and responsive base for your pelvic organs. They need to be both strong and flexible to do their job properly. These muscles are interwoven with connective tissues. These tissues are called fascia. Fascia acts like a strong, fibrous wrapping. It helps to support and stabilize the muscles and organs. Think of it as an internal support system that holds everything in its correct place. Numerous nerves also run through the pelvic floor area. These nerves are critical. They carry signals from your brain to the muscles and from the muscles back to your brain. This communication allows for conscious control and also for automatic reflexes. The perineum, as we mentioned, is the external surface. It is made up of skin, underlying fatty tissue, and some superficial muscles. These muscles are closer to the surface compared to the deeper pelvic floor muscles. For example, some of these perineal muscles are involved in sexual function and in supporting the external openings. The perineum also contains many nerve endings, making it a sensitive area. It serves as a protective covering for the structures exiting the pelvis. It is an important landmark for understanding pelvic anatomy. Here is an interesting fact to consider. Your pelvic floor muscles are constantly working against the force of gravity. Every time you stand up, walk, cough, sneeze, or lift something, these muscles activate. They contract to provide support and prevent your internal organs from descending. This is a continuous, often unconscious effort that they perform throughout your life. Without this constant support, we would face significant challenges in our daily activities. Their endurance is quite remarkable when you think about it. Essential roles. The many functions of your pelvic floor. One of the most critical functions of the pelvic floor is providing support. It acts like a strong foundation for your pelvic organs. These organs include the bladder, where urine is stored. In women, it also supports the uterus, where a baby can grow. And for everyone, it supports the rectum, which is the final section of the large intestine. The pelvic floor muscles hold these organs in their proper position. This prevents them from sagging or prolapsing, especially during physical activity or strain. Another vital role is maintaining continence. This means having control over your bladder and bowel movements. The pelvic floor muscles wrap around the urethra, which is the tube that carries urine out of the body. They also surround the anus. When these muscles contract, they squeeze these openings shut. This prevents unwanted leakage of urine or stool. When you decide it is time to go to the bathroom, these muscles relax. This allows for controlled emptying. This function is fundamental to personal dignity and comfort. The pelvic floor also plays a significant part in sexual function. This is true for both men and women. Healthy, well-toned pelvic floor muscles can contribute to increased sensation and sexual satisfaction. During sexual arousal and orgasm, these muscles contract rhythmically. These contractions are an important component of the sexual response. Problems with the pelvic floor, such as weakness or excessive tension, can sometimes impact sexual health and enjoyment. It is an aspect that is often not discussed, but is very relevant. Furthermore, your pelvic floor muscles are key players in core stability. They work in coordination with your deep abdominal muscles, your back muscles, and your diaphragm. This group of muscles forms your body's central stabilizing unit. A strong and functional pelvic floor helps to support your spine. It contributes to good posture and efficient movement patterns. It even plays a role in proper breathing mechanics by working with the diaphragm. Its influence extends far beyond just the pelvic region, affecting your whole body.
Pelvic health.
Fortunately, various issues can affect the pelvic floor and perineum. One common problem is urinary incontinence. This is the involuntary leakage of urine. Stress incontinence happens when leakage occurs during activities like coughing, sneezing, laughing, or exercising. Urge incontinence is when you feel a sudden, strong urge to urinate and may not make it to the bathroom in time. These conditions can be distressing. They can significantly impact a person's daily life and confidence. Many people experience this, but help is available. Another potential issue is pelvic organ prolapse. This occurs when the pelvic floor muscles and supportive tissues weaken. As a result, one or more of the pelvic organs can descend or bulge into the vagina. For example, the bladder, uterus, or rectum might shift from their normal position. This can cause symptoms like a feeling of heaviness or pressure in the pelvis. Sometimes a bulge can be felt or seen. Prolapse can range from mild to severe, and it is important to seek medical advice if suspected. Chronic pelvic pain is also a condition that can involve the pelvic floor. This refers to persistent pain in the pelvic region that lasts for 6 months or longer. The pain can arise from the muscles themselves being too tight or in spasm. It can also be related to nerves or other structures in the area. Childbirth, surgery, injuries, or even prolonged stress can sometimes contribute to pelvic floor dysfunction and pain. It is important to remember that men can also experience pelvic floor problems, including pain and incontinence. The good news is that much can be done to maintain pelvic health and address problems. Awareness is the first crucial step. Understanding these muscles and their functions empowers you. Specific exercises, often called Kegel exercises, can help strengthen weak pelvic floor muscles. Relaxation techniques can help if muscles are too tight. Lifestyle changes, such as maintaining a healthy weight and avoiding constipation, can also be beneficial. If you experience any symptoms, please do not hesitate to talk to your doctor or a specialized physiotherapist. A healthy pelvic floor is vital for a good quality of